Now, Ebenezer, you have mentioned a very good thing, a very important thing, listening to your own body and knowing when sickle cell crisis is going to start. Now, there are there are differing views. You have worked in a hospital where there were two hematologists. On the ward of one hematology, patients were dying. On the ward of the other hematology, patients were not dying. Now, I don't want you to mention the names of the hematologists, but to make a short statement as to why patients were dying under one hematology and not under the other hematology. Just a short statement, and then I'll go further.
Anyway,
I don't want you to mention the hospital or the names of the consultants,
that's
but
right.
mention the experience because it was you
Yeah.
who confronted one of the hematologists.
Anyway, from my experience, what I have noticed, especially having to
Dispense.
be in a hospital myself, and I have also been treated with a painkiller drugs, which I mean, some I would say narcotic. That is morphine, and a stage I have been given pethidine. I realize that having to take the morphine and having to take pethidine, any of these strong narcotics, instead, right, that takes the pain away, but the after effect is unexplainable. You tend to feel respiratory depressed. I found it so hard to breathe
Right.
and
Now,
things like that.
you made a very good point there. The strong narcotic takes the pain away. I'll give you a definite example. A lady comes into hospital with a sickle cell disease, SS, sickle cell anemia, sickle cell disease, SC, sickle cell disease, with abdominal pain.
Yes, but
Now, with abdominal pain, when she comes into a casualty, they know that she has sickle cell disease and the pain is severe. So the first thing they do, or the first thing the patient is asking to be done, is to be given the painkiller. And in this country, in the UK, they give diamorphine as well.
yes,
But this lady who was coming with abdominal pain had missed her periods for 8 weeks. And the pain that she had come in with is ectopic pregnancy. Okay?
mm-hmm.
Or,
Yeah,
or acute appendicitis. All right?
mm-hmm.
If
That could
without
be, yes.
asking the patient, when was your last period, there was little time to find out from examination of the lady that she got blood in the abdomen because ectopic pregnancy had burst. So what you said that takes the pain away, but pain will be taken away, but the consequences of the pain. But tell us about the two
and
consultants
and
in
and and that is the point. I mean, I am getting into because I
your
am
experience.
bringing my experience into
Your
this,
experience, right?
because my experience having to have that as a patient,
Mhm.
a sickle cell disease patient.
You know that you can't breathe with morphine. You
I
can't breathe
can't
with
breathe with
you
morphine,
can't breathe with diamorphine.
and I can't breathe with the diamorphine. This is just after effect.
And
What I did. And instead there, something I realized that at times when you tend to experience these after effect crises, it tends to send you back into crisis.
right.
And these things prolong your stays in hospital.
Hospital.
I did experience these, and I saw that happen as well to patients I have worked with. in one of the hospitals where I did work.
Right.
And this hospital, I work under two consultants.
Yes.
At one stage there, I was involved in like with sickle cell patient, and at one stage I was with like say patients with HIVs and things like that.
And the pharmacist. But what I want you to stress is this: that is not all doctors in the UK who give morphine and diamorphine. Some will do, and others will not. But the important thing is this: that opinion of experts differ, and the way to take the opinion of the one that will help you is to get hold of achievers like you who will give their experience. Now, of the two consultants, why do patients die on one ward more than the other in the same hospital where you have worked?
Oh yeah, the fact
Without
is,
mentioning their name.
yes, the fact is, if you introduce, like, say, these strong narcotics to patients, at times, what we as health workers, if you're working with these sickle cell patients, you never realize it. At times, it can send them into coma. And I saw that during time I was working in one of these central London hospitals. It did happen. It did happen to a very good friend of mine who was brought into hospital. This person usually come and go. But this particular day, this person was brought into hospital with sickle crisis. Right, was put on morphine. And with the morphine, things went very bad and end up in intensive care. Intensive care, they tried to reverse the morphine with naloxone, I think, if I could remember, and things never worked.
And the patient died.
And the patient died.
Yeah. Now, you don't even have to elaborate this. The British government instituted an inquiry into how and why patients died. And in 2008, they published a report. Those who are doctors and nurses who are listening, please Google INCEPOD, capital N, capital C, capital E, capital P, capital O, capital D, INCEPOD report, Sickle, National Confidential Inquiry into the outcome of patients and death. And you'll find the INCEPOD report, which is not by you or by me, but by British professors. Listen to what they said about morphine and diamorphine in sickle cell disease. They said, and I quote, of 42 patients admitted into hospital with sickle cell, painful sickle cell crisis, when they died, 19 of them, nearly 50% of them, died from overdose of morphine and diamorphine. It isn't you who are saying this. It's not I who am saying this. It's British professors who are saying this. And yet, the recommendation by the best authorities in this country, the recommendation continues that when the patient comes in, give a big dose of diamorphine. Now, how do the patients react to this? Those who are listening to us react to this. Answer: look after your body as you do it, so that you don't end up in sickle cell crisis. When was the last time you, at the age of 60 and 4 months, when did you last have a painful sickle cell crisis? 10 years, 15 years, 20 years?
I cannot remember the last time I suffered
No,
a
no, it's
painful
important to say whether it's 20 years
crisis.
or 30 years.
I mean, a major crisis I did have.
Mention the year.
That
People are interested in that. How many years ago?
that would be about, say, the last 25 years or
Right.
so. I have never.
Okay. So here is a sickle cell anemia SS patient, sickle cell disease SS. Now, the term sickle cell anemia is reserved for SS only. Sickle cell disease is also sickle cell anemia, but you mention SS in brackets. When you mention sickle cell disease, that sickle cell plus another 8 hemoglobin, you mention that SD or S. Korle Bu or SC. So the last time a 60-year-old sickle cell disease patient called Ebenezer Tego, the last time he had a painful crisis was 25 years ago. And this is because you've been listening to your body. And two, tell us about the water.
When we're talking about, like, say, a painful crisis, I would like to emphasize, to explain that area. With sickle crisis, we all know that, yes, if, say, you trigger the things you should not do, that would send you into a crisis. And in my case, things I know that would send me into a crisis, I tend to avoid it.
This is lesson number one. Avoid the things you know are going to send you into crisis.
Things like, for example, it is very cold. Standing at the bus stop with just, a light kind of jacket or things, that can send you into crisis.
Improperly clad.
Yes, improperly. Also, fluid intakes. If you're not taking the required amount of fluids, that can send you into crisis. Dehydration.
Hot weather when
you sweat, that can.
You add a little salt to the orange juice.
That's correct.
And you drink a lot of water.
And also, at saying, because of all this, I tend to avoid, and this is why I could stand and say, for the past 25 years, even moving on to about 30 years, I have never
had a sickle cell.
Suffered a severe crisis.
Thank you very much. We shall continue with the statements of other achievers, but we can use you again in the remaining sessions when we talk about a recommendation which is being taken up all over the world, something which is called hydroxyurea. I know the professor at Johns Hopkins who introduced it, but it was introduced on the basis that it increases the amount of fetal hemoglobin F, which is a good hemoglobin in the body, and reduces the amount of S. But this is the whole point. You do not manage patients with sickle cell disease by concentrating on the blood cell. You manage sickle cell disease patient by concentrating on the patient. And the disease itself compromises the kidney. People who have sickle cell disease tend to have dodgy kidneys as they grow up. and suddenly to load them with a lot of urea, which is the substance that the kidneys remove out of the body, and you give that urea, which is an anti-cancer drug, to the patient. When you get somebody who has been taking hydroxyurea for 20 years, who is still alive, let me know. Have you ever taken it?
And never.
You have never taken it, and you are 60 years old, and somebody has told me that you look like 40 years of age when you were born on Ghana's Independence Day.
I've never taken hydroxyurea.
And you have never
I have worked with, I remember when first hydroxyurea came, and I was working in one of Central London hospitals.
Don't mention the name of
yeah,
the doctors.
In one of Central London hospital, and I was involved with dispensing of chemotherapy drugs and things like that. And this is when I first came across this hydroxyurea. And even for us to approach to dispense it, we have to use gloves.
You have to use gloves to dispense it.
Because it is a carcinogen.
It is.
And my worry
Yeah.
to some of the sickle cell patients taking it at this present moment.
Yeah.
When anytime I heard, it's been given to, how are they kind of like handling that hydroxyurea capsules in their homes?
Which you, as a pharmacist, handle the capsules only with your gloves.
Yes, you have to, and because you have to make sure you don't come into contact, even when we put on the tablet counters, we use spatulas to count them.
And this drug is being given today to children with sickle cell disease in Liverpool right now. Why? Because a big authority has said that it should be given. But the point is this. This is why I don't write often about sickle cell disease. I almost always write about the sickle cell disease patient, because what is good for the cell, like increasing the fetal hemoglobin, may be lethal for the patient. And in our subsequent sessions, I shall mention why siblings in the same family with the same phenotype, aka, behave differently under the same roof. All this is in my book.